Dogs cannot walk up to you, tap you on the shoulder, and explain that something feels wrong inside their body. They rely entirely on the signals they send through their behavior, their posture, their eyes, and the subtle shifts in how they move through their day. As a dog owner, learning to read these signals is one of the most important skills you can develop, because catching illness early can mean the difference between a simple treatment and a serious medical emergency. The challenge is that dogs are naturally wired to hide weakness. This instinct goes back thousands of years to their wild ancestors, where showing vulnerability could attract predators or cause them to lose their standing in the pack. So even when your dog is feeling genuinely terrible, their first instinct is often to push through it, to keep wagging that tail, to greet you at the door as if everything is perfectly fine. That is why you have to look deeper, past the surface performance, and pay attention to the quieter, more honest signals their body is sending. One of the earliest and most reliable signs that something is off with your dog is a change in how they eat or drink. A dog that suddenly loses interest in food, skips meals they would normally inhale in seconds, or turns away from their favorite treats, is sending a clear message that something is not right. Occasional skipped meals can happen for minor reasons, but when the pattern continues for more than a day or two, it deserves serious attention. On the flip side, a sudden and dramatic increase in appetite can also signal a problem, particularly conditions like diabetes or Cushing's disease, which affect how the body processes nutrients. Water consumption is equally telling. A dog that is drinking significantly more water than usual, constantly returning to the bowl, or seeking out unusual water sources like puddles or toilets, may be experiencing kidney disease, diabetes, or hormonal imbalances. Conversely, a dog that stops drinking water altogether is at risk of dehydration, which can escalate quickly into a dangerous situation. These changes in consumption habits are often the body's first visible cry for help, and they should never be dismissed as just a phase or a picky mood. Beyond eating and drinking, the way your dog behaves on a daily basis is a powerful window into their internal health. A dog that is normally bouncy, playful, and eager for walks, but suddenly seems uninterested in activities they used to love, is showing you something important. Lethargy is one of the most common signs of illness across a wide range of conditions, from infections and pain to organ dysfunction and cancer. It is not just about being tired after a long day of play. It is a persistent, heavy kind of stillness that does not lift with rest or encouragement. You might also notice your dog becoming unusually withdrawn, hiding in corners or under furniture, avoiding eye contact, or pulling away when you try to pet them. This kind of social withdrawal is deeply significant because dogs are social creatures by nature. When they start isolating themselves, it often means they are in pain or discomfort and are instinctively seeking a quiet place to cope with it. On the opposite end of the spectrum, some sick dogs become unusually clingy or anxious, following you from room to room, whimpering softly or seeming unable to settle. Both extremes, the withdrawal and the clinginess, are worth taking seriously. Your dog's body itself carries some of the most direct evidence of illness, and regular physical checks can help you catch problems before they become severe. Start with the eyes. Healthy dog eyes are bright, clear, and alert. Eyes that appear cloudy, red, or have unusual discharge, or that seem dull and glazed, can indicate infection, injury, or systemic illness. The nose is another indicator worth monitoring. While the old belief that a wet nose always means a healthy dog is not entirely accurate, a nose that is consistently dry, cracked, or producing thick and discolored discharge is worth noting. Check the gums regularly as well. Healthy gums should be a moist, bubblegum pink color. Pale, white, yellow, or bluish gums are serious warning signs of conditions ranging from anemia to heart failure and require immediate veterinary attention. Run your hands gently along your dog's body during regular cuddle sessions. You are feeling for lumps, bumps, swelling, or areas where your dog flinches or pulls away when touched. Unexplained weight loss, even when appetite seems normal, is another physical red flag. A dog that is visibly losing muscle mass or whose ribs and spine are becoming more prominent is likely dealing with something that needs professional evaluation. Changes in your dog's bathroom habits are among the most direct indicators of internal trouble. Vomiting once after eating grass or something unusual is generally not cause for alarm, but repeated vomiting, vomiting that contains blood, or vomiting accompanied by other symptoms like lethargy or bloating is a different story entirely. Diarrhea that lasts more than a day or two, particularly if it is watery, contains blood, or is paired with vomiting and weakness, can lead to dangerous dehydration and may signal infections, parasites, or more serious gastrointestinal conditions. Constipation is equally important to monitor. A dog that is straining to defecate, producing very small or hard stools, or crying out during bathroom attempts, may be dealing with blockages, prostate issues, or other internal problems. Pay attention to the frequency and consistency of bathroom trips. Any significant shift from your dog's normal routine, whether they are going more often, less often, or struggling with the process, is information your veterinarian needs to hear. The way your dog breathes can reveal a great deal about their health. Normal breathing should be quiet, effortless, and rhythmic. If you notice your dog breathing faster than usual while at rest, breathing with visible effort, or breathing with their mouth open when they are not hot or exercising, these are signs that something may be affecting their respiratory or cardiovascular system. A persistent cough, especially one that sounds wet or productive, or one that worsens at night or after exercise, can indicate conditions like kennel cough, heart disease, or fluid in the lungs. Wheezing, snoring that appears suddenly in a dog that did not snore before, or any kind of labored breathing should prompt a call to your veterinarian without delay. Unusual vocalizations also fall into this category. A dog that whimpers, yelps when moving or being touched, or groans when lying down is communicating pain as clearly as they possibly can. At the end of the day, no one knows your dog better than you do. You have watched them sleep, eat, play, and move through the world in their own unique way. When something feels off, even if you cannot immediately identify what it is, that instinct deserves respect. Veterinarians consistently say that owners who come in saying something just seems different are often right. That vague sense that your dog is not quite themselves is frequently the earliest warning sign of all. Do not wait for symptoms to become undeniable before seeking help. Early intervention almost always leads to better outcomes, less suffering for your dog, and often lower treatment costs. Keep a mental or written note of any changes you observe, including when they started, how often they occur, and whether they are getting better or worse. This information is invaluable to a veterinarian trying to piece together what is happening inside your dog's body. Your dog is counting on you to be their voice, their advocate, and their first line of defense against illness. The more fluent you become in their silent language, the better equipped you are to give them the long, healthy, happy life they deserve.